Come on, come on. What do we want? Fair pay. When do we want it? Now.
It's a historic moment for Ramsay. We've never been on strike before.
We're finally taking a stand.
Stop being a Scrooge. Open your purse strings.
Ratios and fair pay. That should be the Ramsay way. Ratios and fair pay. That should be the Ramsay way.
The signs speak volumes. Ramsay's 11% pay rise rejected. Nurses now pushing back as frustrations spill to the streets.
We'd rather be inside looking after the patients. It's what we do. But when you find out that the people working for the same company in another state are earning a considerable amount more than us an hour, well, you know, you've got to stand up for yourself and come out and have a go.
We've been pushed to take this action. It's not something that we've done lightly, and we know that it impacts the public, and we appreciate the community support behind this.
Surgery at Sydney's North Shore Private Hospital was delayed this morning after more than 150 nurses and midwives walked off the job for 4 hours. Staff at hospitals run by Ramsay Health are taking industrial action amid negotiations over pay and conditions which have been ongoing since March last year.
We have many nurses here that are living paycheck to paycheck. Enough is enough. Start putting people ahead of profits.
Ramsay have continued to post a healthy profit, not only here in Australia, but in the UK and elsewhere. This is not a company on the bare bones of its bum. Let's be clear.
Ramsay, if I hear you say one more time that you're experiencing significant financial challenges, I think I'm going to scream, because we are experiencing significant financial challenges, a lot more than you.
I turned up today to hear some of you are going through a realignment of your wages. Shame, Ramsay, shame.
Look, honestly, we love our job. We're so passionate, and it's the only reason we're still here. When we get our paycheck, it's so depressing, but you know what? We do it for our patients. We're doing it for you, Ramsay. So come on, look at us so we can look at you as well.
It's a calling to be a nurse, but it's also very heartbreaking to be pushed out to be on the streets to ask for what you deserve.
Lake Macquarie Private Hospital staff walked off the job today, calling for better wages and conditions.
So we've been in negotiations for 13 months with Ramsay with no actual, they're not coming to the table. So sadly, we're out here taking industrial action, trying to get what we deserve.
I say nurses, you say power! Nurses! Nurses! Can we look at each other? In the middle of the gun! Ramsay, it's your gun! Otherwise, try to understand it. Make your voice and make it clearer!
But Ramsay have really underestimated the strength of this union and the strength of your relationships to each other.
Empowered. I feel empowered. I feel confident. I feel awesome. I feel every adjective like that. I'm so proud.
I think it's absolutely amazing. I'm so proud of all of us for sticking together for what we believe in.
It's very empowering being here today.
I felt united.
Powerful.
It's exhilarating.
I think it's time that we just make a stand.
Well, this weekend we had not had much staff and patients were very evident, so we couldn't really deliver the care that we really wanted to.
We're working 12-hour shifts without a break. By the end of the afternoon, you actually feel like you're drunk. You're starting to feel like you're going to make a mistake, and it's just really, really dangerous.
Private sector nurses walked off the job in Port Macquarie today. Some operating theatres were closed as a result of the 4-hour work stoppage. Samantha Crowe was there and joins us live now from Port Macquarie. And Sam...
Well, NIC nurses here at the Port Macquarie Private Hospital are campaigning for better pay and better staff-to-patient ratios. They say they won't stop their fight until Ramsay Health comes to the table.
They're tired, they're not getting paid correctly, they're doing overtime, they're doing extra shifts. It's time to give back what we put into this hospital.
Nurses frustrated they're earning much less than their Queensland and Victorian Ramsay Healthcare counterparts.
It's the same job, same mob. We should be paid equally. Just appreciate your nurses. Like, come work a day in our shoes and see how it feels.
We're all united because every hospital of Ramsay has the same culture. It's coming from above, and this is the way they want to treat their nurses and midwives.
You've made history here. When you're under attack, what are you going to do? Stand up, fight